it's a great pleasure to welcome you. What is the third in the series from the project CELIS, and third from our side, from Tartu side. I think Elleri already told you a little bit about CELIS the last time, but just to make a brief introduction, the CELIS project focuses on the digitalization in life sciences. And I will already start sharing my screen so we can then move forward with my presentation, which is the next one anyway. So the CELIS is a partnership between 4 regions. There's BioRN, there is Flemish Smart Hub, BioPeople from Denmark, and Tartu BT Park from Estonian side. And the aim of the project is to discuss the opportunities and especially opportunities for companies in the field of digitalization of life sciences. So we will provide you with insights on how these regions are doing, what are sort of more relevant areas in digitalization in this region, briefly introduce what's going on, what are the opportunities, and would be inviting you all to visit these regions, which is of course currently not possible and could even be considered a little bit foolish to invite you over. Elleri, is there anything I'm missing currently, or should we just go on with the presentation? We still have a couple of minutes as an intro, so I don't know if Annalisa or you would like to add anything to a general introduction, or shall I just go forward?
I think you can go forward. We have plenty of interesting content ahead.
I also agree, and if I missed anything, then please comment in the chat. Elleri can take a look at that. Since I'm full screen, I don't see the chat, and Elleri can help me out in this regard. If you have any comments or questions, then just go forward and ask, and either to me or to other people as well. Okay, I will tell you today a little bit about Estonian digital life science market, and when we talk about Estonia health in this regard, that digitalization in Estonia in life sciences has mostly happened in health technologies. And just before we go forward, I would like to mention that views here are not official views of European Commission or the ESME, and of course to this or that you may get from my presentations cannot be traced back to European Commission or to ESME in any way. So briefly about the general background of our general situation in the health technologies. So I think these 3 topics are not news to anyone, and the general background in the healthcare systems is that they are facing, and all the, at least in the Western world, all the societies are faced with increasing cost of the healthcare. And there are many drivers behind it. One of them, and that means that there is less and less people who are willing to pay for the service if this is if the service is maintained centrally by the state, and there are more and more people who want to use it. So of course this sets the balance. If there are less payers and more users, then the balance will be towards higher exploitation of the resources. And what's been also discussed quite a lot is that due to the relatively increasing cost and more people using the system, the access is rather sometimes limited, and for example in Estonia, getting to a specialized doctor can be sometimes rather tricky. And I think this is important also in the context of Estonia, as we'll later show you that we are developing set of digital tools, or thinking towards digital tools, how to reduce the doctor queues at the doctors and make the overall healthcare system a little bit more sustainable and easier to access. And when we talk about increasing cost, then also some increase comes from recent drug developments, where quite many challenging diseases have found treatments which are often quite expensive. And what we see in Estonia is that these new developments seem to be a bit too expensive for Estonians sometimes, and it's difficult for the system to maintain these kind of treatments. Now, a little bit about the country context. As you may know, Estonia is awfully small region. If you look at that, we only have less than 1.3 or around 1.3 million people. So this is not considered really a market. I will hopefully come back a little bit later to this, that we are seen often as a test market, as a digital country, and good access to healthcare. So we're sort of, especially from outside Estonia, we could be a stepping stone to future European markets. In our living standard is I would say in the middle of the pack in EU, as it is also with the physician density, nurse and midwife density, and I think also with hospital bed density. So we're rather a common European country. As it also goes to life expectancy. Now, when we reach the total health expenditure of the GDP, then in EU, Estonia, I think, is third to last or fifth to last, or in this range. So there are two things to understand here. One is the total amount of money that goes to the health system is low. But secondly, the ability to create value from this funding, I'd say that Estonia has been quite good in this sense, that the relative level of healthcare has been acceptable, and regardless of the service has been maintained and managed in a good way. And I think the internet users percentage is a little bit higher these days. I think we have crossed the 90% line, or did cross that last year. So we are rather, but yeah, I mean, this is also in the middle of the pack. We're not very different from what's normally happening in EU. So what you should know again about Estonia is that we are in many sectors, we're constantly moving. 95% of health records are digital, and over 99% of drug prescriptions are currently digital. I will come back to the X-Road, which makes this possible. I will come back to that a little bit later. So we can be perhaps considered as an advanced digital society. Our government is digital, and there's quite a bit digital services that can be skills, infrastructure, and there's also legislation available for different digital approaches. Cybersecurity is an important thing to mention here, as we host one of the NATO cybersecurity research centers in Estonia. And IoT, 5G, blockchain, these are keywords that arise in the context of digital lifestyle, digital technologies these days quite a bit. So Estonia actually have tested how the digital health in blockchain might work, and there's some information about that as well, some experience. Now, I already briefly mentioned the X-Road. So the X-Road is a secure data exchange layer which was developed by Estonian government, and it helps to connect different data registries. And in theory, this creates the opportunity of not joining, but gathering data from different data silos, and some are mentioned here. For example, the patient portal, and patients can access their health data through the X-Road with their ID card. And Estonia has actually gone a little bit further and introduced e-residency, which is a governmental program that invites foreign entrepreneurs to come to Estonia and establish a company in Estonia. You can do this online and you can run your company online. Which makes it currently a little bit difficult is that to open a bank account, most often you still have to be present in Estonia, and I'm not sure they have found a good way around this due to a potential threat and with money laundering. But other than that, it's a nice scheme. There are quite a few companies established in Estonia that are actually run from abroad, and you don't have to come to Estonia to file your taxes, or you can do this online using your e-residency card and use the governmental e-services that are provided with the help of the X-Road. And just one small note here as well, that Estonians can also vote abroad using this X-Road or this exchange layer. And for example, I was in India during the local government, Tartu city government elections, and voted from my hotel in India for that, and that worked quite well. And when we talk about digital registries in Estonia and the X-Road solution, then similar or very similar solutions have been applied in other countries. And what we can talk about here is, for example, the e-prescription get an e-prescription in Estonia and then take your ID card to Finland and buy it from the pharmacy the drugs you need, and vice versa. The same thing with Finland. And this is a part of a bigger European approach, bigger European exchange, or this kind of a free movement between different countries would be available. I'm getting a notice that my internet connection is unstable, so please let me know if I disappear or if this is lagging. Ellery also knows my phone number, so she can give me a call in case something happens. Now, when you're entering Estonia, it's good to have a contact point. It's good to have someone who can help you move forward. So we present Tartu Health here a little bit. Tartu Biotechnology Park is the organization that organizes the activities of Tartu Health Cluster. Scanbank is an organization that takes a look on the Baltic Sea region level regarding the countries that are around Baltic Sea, and opens opportunities for companies in this area. We have to consider that there we have also Finland and Denmark and Sweden, which are all very highly developed. Connected Health Cluster is another cluster in Estonia that contains several digital health startups and major players. And this is managed by Science Park Technopole, and Medicine Estonia is a medical cluster that they're not currently very active as far as I know. Maybe I'm hoping I'm not being too harsh on them, but their main activity was the medical tourism and helping people reach Estonian medical services physically. So briefly, just a few words about Tartu Biotechnology Park. We are a rather common science park, which means we contain lab and office space and offer both business development services and actual physical research. We have our own small incubator where we can help companies with the Estonian market, but also going forward when they come from abroad. And I'm getting a message that maybe I should try to turn off my camera. I hope this will be fine with you. Hopefully the overall presentation will not suffer much. So sorry, I will just try to turn it off here. Let me see where I can find it. Okay, I'll stop my video and let's come back to the presentation. So sorry about that. And in the incubator, we work with sort of companies, and they can technically also be from abroad. And we do quite a bit of collaboration all over Europe. For example, the SELIS project I already mentioned, but there are many others. With the Big Plus project, we develop guidelines for biomarkers, and we are also EIT Health Research Hub, which means we work with Estonian ecosystem jointly with EIT Health and Genera is another project that works with companies in the genomics area and helps to find new markets and new market access for those companies. We're also part of Estonian Connected Health Cluster, as already mentioned, and we're part of different collaboration networks in Scanbalt, in Submariner, Estonian Connected Health. We do quite a bit of collaboration with different parks in Europe, and also our co-organizer Startup Day Business Festival. So this hopefully gives a little bit of background of how we can help you and what are our competencies. Briefly about Scanbalt. So as I mentioned, Scanbalt is a similar network. It's a cluster of clusters or a meta cluster around Baltic Sea region. And the aim of Scanbalt is they offer also communication and regional competencies. They provide market access to different markets. They act as a project accelerator. They're a think tank and also importantly networking. So currently the organization contains members from Sweden, Finland, Estonia, Latvia, Lithuania, Poland, Germany, Denmark, and Holland. So through the clusters, there's also an opportunity to access different markets. Now going back more specifically to Estonia, what you need to know is that the healthcare service in Estonia is managed by the governmental organizations. So how it works is that the health is financed under Ministry of Social Affairs, and they have a specific body for this, the Health Insurance Fund, and the Health Insurance Fund is the body that finances all healthcare services which are not privately managed, and they also fund some of the private hospitals and private clinics and their healthcare services as well. I briefly mentioned TEHIK. TEHIK is the organization that has developed the X-Road and I think this was Information System Authority who created the X-Road, but TEHIK is responsible for creating the health and welfare information system, and they are managing the everything that is related to the patient data and access to this data. And National Institute for Health Development is a sort of R&D sort of development organizations. They provide insights on the health of people. They do investigations and research how the Estonian health is doing, and based on this, they provide suggestions to Ministry of Social Affairs and how they should be running the Estonian healthcare system. There are quite a few research and CRO capabilities, which when you're entering Estonia might become handy to make sure that you are developing your project in the right way, in the right direction. Of course, University of Tartu is important to mention here. They're the largest university in Estonia, and they get about half of Estonian science funding and provide more than half Estonian scientific output. They're also the only university in Estonia that is able to teach medical doctors. And the Institute of Clinical Medicine and Tartu University Hospital jointly provide help with many clinical trials and 2 clinical trials, for example, and are quite active in collaboration and helping companies move forward. What I would also mention here is the University of Tartu Institute of Genomics and Estonian Biobank, which are a population-based biobank currently holding more than 200,000 DNA samples from a common population of Estonians, and they're very open to collaboration with different companies and have done many collaborations over the years. One that comes to mind, good collaboration with startup BioAge that has with the data received or with a R&D work received from the Institute of Genomics has raised, I think currently, recently they raised Series B and received quite a bit of venture capital funding in the States. There are a couple of more hospitals and universities. North Estonia Medical Center is, of course, a large medical center. TalTech is another university that works towards digital health and helps to figure out which way the digital health society should be moving. And we have a couple of healthcare colleges and Tallinn University as well. A couple of CROs I'd like to mention here are Eliko Tehnoloogia Arenduskeskus or Technology Development Center of Eliko. They are more, and also the stack, they are more on the ICT side. The Competence Center of Health Technologies is more on the health side. So when we're talking about digital health, then the collaboration of these organizations might help you develop your project. Some of the recent example project and support infrastructure is that, as I mentioned, the e-prescription service, and which is now currently tested and piloted and working jointly with the Finnish system. E-consultations and e-monitoring, here I have marked the HIF, which is the Health Insurance Fund, and the COVID-19 pandemic gave quite a push towards e-monitoring and e-health services, e-health consultations. In Estonia, the numbers, as in other places, rose, and currently Health Insurance Fund is developing new guidelines for e-monitoring and will be piloting with a couple of companies the e-monitoring system, so that people who need regular visits to the doctors could do this through an app or online in some ways. Hoia is an app for COVID-19 pandemics, which many countries have a similar version, and where phones communicate through Bluetooth, and if a person is tested positive with the COVID-19 test, then everyone who has been in contact with the person will get a notification that they were in proximity of that person. I briefly already mentioned Estonian Biobank and Genome Center, and Nutikas is a smart specialization measure that would help companies that want to have a Estonian legal entity to ask for support from Estonian government to perform R&D activities. So depending on the activity, 70 to 45% of the activities will be reimbursed by the Estonian government. But this measure just ended, but as far as I know, a very similar measure will be opened in the upcoming month for the next framework period. So the main topics now in Estonian market, and then when you're thinking about entering Estonia, is of course data interoperability. So in Estonia, even the hospitals don't always communicate freely. The hospital systems, the ICT systems, digital systems are not directly compatible. So we're working towards that to have a good set of standards and be able to allow the data exchange between different entities. This, of course, requires some investments into digitalization, and maybe there are some opportunities here as well. What, of course, is a limiting factor here, and what has to be kept in mind is the amount of innovative tenders from the government sector, from the public sector is rather limited. I mentioned one from the Health Insurance Fund when they will be piloting some of the services in the Estonian market. So this could be an opportunity maybe for the companies. I mentioned in the very beginning that we're a small market. We're a market that can be used as a sandbox and to play around a little bit with opportunities before entering a larger market. And there's quite strong public and private sector collaboration. So the public sector is directing in a way the bigger steps in Estonia. As I mentioned, the recent developments are road ahead. There will be teleconsultations, and distant monitoring will be one of the main topics. So what are the market growth and opportunities? I think the healthcare systems got a rather big push from the COVID-19, but if this is sustainable, I'm a little bit cautious in stating this. So I don't foresee very big increases in the market growth in Estonia. One thing that will be looming in the near future is hopefully the use of genetic data, especially in prevention, with the help of Estonian Genome Bank and all the research they've been doing, figuring out what kind of genetic markers are responsible for what kind of phenotypes in a person's lifetime. So that was briefly from me. This is not my picture here. This is Annaliisa's picture, as she's the manager of the project from the lead partner BioRM side. You can see the general information about the CELIS project, and also Annaliisa's email and also my email down below. You can contact me or Annaliisa if you have any questions about the CELIS or entering Estonian market. And if you have any questions now, I'd be happy to answer you. So thank you.
Thank you, Sven. So I think next we have Neil Thomas. And just as a short introduction, I think we all heard Neil last time, an excellent presentation by him. You know, he created a lot of excitement in, you know, the life science domain. And he has been a founding team member of ZipPrime and a partner in Ventac Partners since 2012. He has worked in protection and commercial exploitation of academic and international intellectual property in the biotechnology sector since 1997 within both legal and business environments. He is currently CBO of Idogen AB in Lund, Sweden, and CBO of Cube Labs Group of Companies, Milan, Italy. Neil has been advising the University of Tartu, Estonian technology transfer and related matters since 2012. He holds a bachelor's degree in biological sciences from University of Birmingham, UK, and a PhD in biochemistry and molecular biology from the University of Durham, UK.
Okay, so I'm going to tell a little story about how ZipPrime went from Ankara to Tartu via Madrid and entered the Estonian life science market. So what is ZipPrime today? Well, it's a molecular biology company, and we have a clever technology for capturing very rare nucleic acid molecules, DNA from a cancer sample, RNA from a virus sample, for example, and that can be for cancer diagnosis. Principally, we are trying to pick up rare fragments of DNA from a tumor, and by reading the information in those rare fragments, you can decide the best possible treatment for that patient, or give them a prognosis on their disease because you know they have an aggressive or non-aggressive cancer. As it happens, the clever trick that we use for finding these very rare sequences is also applicable in preparing samples and testing samples for SARS-CoV-2, the cause of COVID-19. So the pandemic has a small silver lining for our company, at least. We founded the company in Estonia in December 2019 to build on the original ZipPrime that was founded way back. I'll tell you a bit more about that in a minute. And to develop the technology we've been developing since 2011 in Turkey. The idea behind launching ZipPrime in Estonia was to access local R&D that we know well, but also to have a foothold in the EU in a very easy place to do business remotely, because I'm based in Madrid. We have one founder in Ankara. We have another founder in Baltimore, Maryland. It's very good for us to be able to run this company remotely. So the ZipPrime COVID range is what we're currently trying to sell in Estonia and through Estonian contacts. We have a viral transport solution that inactivates the virus but preserves any genetic information until it can be sent to a lab, and that can either be sold in 20 liters or in a small tube with a swab for patient collection. We also have a kit for quickly extracting the DNA that's recently been informally approved by the Turkish Health Ministry. And we have another kit for isolating the nucleic acid, the RNA from that virus. We're also working on a diagnostics kit which can tell you which strain of the virus you have, but that's still in some validation and should be available for selling in the next few weeks. So far, all of our sales have been from Turkey to China, within Turkey, Azerbaijan, Kazakhstan, some very exotic countries. We're hoping to replicate that business via the Estonian company in Europe. Okay, so where did it all begin? Well, it began in Ankara in 2008 at the Middle Eastern Technical University. The founders of ZipPrime founded a company, Bionisil and RNA Art. They weren't working on this technology at the time. That didn't appear until 2011. And based on how this technology works, we called the company ZipPrime, and that was founded in 2014 by a merger of these two companies. What's the Madrid connection? Well, I was teaching a healthcare module on the Global and Executive MBA at IE Business School in Madrid. I was teaching the patents and licenses in the life science industry module. And one of my students was one of the founders from Turkey, a lady called Sila Ataka. Meanwhile, whilst I was teaching that course, I was also working for the University of Tartu in the Institute of Technology, where the Technology Transfer Office used to have its offices. And there I began to discover that Tartu was quite a hotbed of healthcare research, and there were already several startup companies in the Tartu region that had taken the plunge from academic research into the world of industry. There was already some activity on campus to support new entrepreneurs and young companies in incubation, including the Vega Fund in 2014. Also, there's a new community called Startup, based around the Startup Hub and the Startup Day in Tartu. And I realized, I don't know if it was me who saw it first, but I realized that hiding in the word startup was the word Tartu. So I did a really poor logo, as you can see, and registered a group in LinkedIn back in 2013. Again, I don't know if I was the first, but anyway, I started to push with people I knew in Tartu to try and take some of the entrepreneurial spirit from companies like Skype and bring it to life sciences and chemistry and deep tech subjects, where, you know, Tartu is a fairly strong university with plenty of bright young graduates. One of our early attempts was a group called BioWay that was trying to attract some funding, in this case from the UK Embassy, to try and drive life sciences entrepreneurship, considering the high numbers of students in these subjects. That then gave way to what became Startup Day. This was an early version sponsored by Tartu BT Park and with Sven heavily involved, 2015. 2016, it got bigger. Here are some biotech people that you may or may not know on the stage from Tartu. And if we fast forward to next January, we're now seeing a huge event, which last year had 4,400 attendees from 65 different countries. So Startup Day has really exploded. I'm really, really pleased to see this. Not a huge amount of this is life sciences, but as you can see, we have made the effort to have side events that focus on biotech. So anyway, if you hadn't heard of Startup Day before, this could be an interesting thing for you to attend in January. It'll be virtual this year, of course, for people who don't want to visit. So what else was going on in Tartu? Well, in March 2015, I had heard about the e-residency program, where you could become a digital resident of Estonia. I was visiting Estonia every month at this time, and I thought, well, why don't I get one of these cards myself? I actually had no idea what I would do with it, but I thought I'd ask questions later. So I got this card in 2015, I renewed it recently, so I'm still a digital, or an e-resident, I should say. And of course, Estonia is well-known worldwide for its digital health system, which, as Sven alluded to, has really become useful in this current pandemic. So, you know, not only is Estonia making things easy for people who want to run companies from abroad, but it's also an obvious place to go for healthcare, particularly if you're in the digital space. We all know that every Estonian can check their own health records online. They can see their prescriptions, they can see the medical test results. I think you can even see your x-rays, I'm not sure. And coming back to ZipPrime, why were we interested in Estonia? Well, healthcare in Estonia, it's where grandmas go for genetic data. Sitting in Tartu is the biobank, and connected within that biobank are patient records, and you can look at the DNA of somebody and find out what they've been prescribed over the last 10 years with their permission. So this could be a very interesting thing for ZipPrime, finding rare sequences for rare diseases or mainstream diseases and connecting them in some way with the evolution of the health of that patient and the drugs that they've been taking. So why were ZipPrime interested in moving to Europe in the first place? Well, Europe has its obvious benefits, but in our case, we applied to the Horizon 2020 SME instrument. And I think back in 2015, we got 50,000 euros to do a feasibility study for our technology. We then went for the 2.2 million sized phase 2 SME instrument grant. And 5 times we scored above the threshold for funding, but we didn't get funding. All we got was this very nice Seal of Excellence certificate, which, to be honest, hasn't been completely useless. It has enabled us to get a grant through the ERANET network. It's also probably going to get us a national grant in Turkey, but we didn't get the 2.2 million from the European Commission. So we thought, not only would we like to move to Estonia to access digital health, access genetic samples, have a footprint in Europe, but we might have a better chance of getting one of these grants if we include our Estonian EU company in the consortium. So in December, we registered ZipPrime EU, if I've pronounced that correctly, and that's where we'll be doing our business. Our home is Tartu BT Park, thanks to my long-standing friendship and contacts with Sven. Virtual for now, but we are looking at the possibility of future lab space and having 1 to 5 employees in Tartu. We'll see how things develop. Here we have our Swedish board member Rolf in the sheepskin jacket, looking happy because he knows how to deal with the cold. And Ossan, one of our Turkish founders, is looking a little bit more chilly in the beige boots. That's outside the University of Tartu. We were here in December, of course, to incorporate the company and have our first meetings with the biobank and other companies in the Tartu area. So what would we like to do in Estonia? Well, we'd like to replicate the kind of relationships we've had with the ERA network. And here we have brain cancer samples coming from Germany, traveling to Turkey for picking up the rare sequences. Those samples then being sent to Germany to be sequenced and read. And then a bioinformatics company in Novosibirsk actually analyzing those rare sequences and giving some kind of recommendation to the doctors back in Germany. And we've already identified a number of projects where we could set up a similar multi-party relationship with 1 or 2 other Tartu-based entities, either institutes or companies or competence centers. And on the more commercial side, we've signed an agreement with a hospital products distributor, molecular biology products distributor, Lanma, where they will distribute our COVID-19 sampling and detection products. And we are in turn helping them with personal protective equipment suppliers and their sales overseas. What are we going to do next? Well, I mentioned we're hoping to get EU funding, but also there's the possibility of national funding. And we hope that national and EU funding could support a cancer diagnostics project, maybe a non-invasive pregnancy testing project with an entity in Tartu. We would like to develop additional COVID testing products. We might want to manufacture kits in Tartu for distribution around the EU, and also have sales for the EU based in Tartu. So that's our next plan. But in any case, we're in very good company in Tartu, in a thriving ecosystem. There's another map, probably even busier than this map for Tallinn, the capital. And if you want to bring your young startup or even your international branch of your mature company to Estonia in life sciences, then you have plenty of available support. You've got the Biotech Park, you've got the Science Park, you've got the Technopole Park in Tallinn. There are various incubators that allow you to enter their systems and get funding and lab space. Enterprise Estonia is there for advice and grants and tax advice. Startup Estonia similarly can give advice. Then for money, you have people like Health Founders and the Estonian Business Angels Network. And then for networking in the region, of course, you have the Scanbalt bioregion and the business marketplace. So I think that's me finishing a little bit late, but I'd be very happy to take questions along with Sven on this experience. Hopefully, I'd like to say in a few weeks, profitable of moving to Estonia.
Thank you, Neil. I think that was quite a journey. And I was wondering when you started in the beginning, if you would say from Madrid to Tartu in 80 days or, around the world in 80 days, to get that phrase. So thank you again for this. Neil, may I ask you one question?
Absolutely, yes.
So you showed the Estonian ID card. I also have one of them.
Mm-hmm.
One of the things that it enables is you to digitally sign the documents. So ever since you got one, have you signed any documents?
Yes, I have. I think I've signed one. What I use it for mostly, though, is accessing my Estonian, well, the ZipPrime Estonian bank account. But yeah, I've also used it to enter the company registry and upload some documents. But yeah, I think I've signed at least one document, but I wouldn't say I'm an expert. I need to do a bit more work on that.
And if you can also share a bit more about your experience in Estonia with the bureaucracy. So Sven made a claim that Estonia is a very good test bed or a box, right? If I may say that. So how is your experience on that?
Well, I used to live and work, and I'm working again now in Italy, so nothing compares to Italian bureaucracy. Spanish bureaucracy is pretty bad as well. I found the whole process very, very simple, except there are two pinch points. One is visiting a notary and the certain things you still have to do in front of a notary in Estonia. And if it wasn't for the help from Sven and other colleagues at Tartu BT Park, we would have had a real problem, I think, incorporating the company and enlarging the board. The other was getting a bank account. It was super easy getting one with TransferWise, but some companies want to see you with a more reputable bank account, perhaps. And we really struggled to get a bank account with LHV. There were, I think, 30 emails backwards and forwards. There were visits to the branch by me, visits to the branch by Sven, but eventually we got there. We were trying to explain that our products might be related to drug delivery, but they're not related to narcotics. They were being so cautious. I don't know why. I know there have been some banking issues in Estonia, but we found it quite incredible how difficult it was to get a bank account. And it's a common complaint from e-residents.
Yeah, I can imagine, I have my bank account with LHV as well, and I had quite a smooth experience, didn't face any issues. But when I went to deposit the money, I, compared to my Indian experience where we are quite used to, having people for everything. So they told me that you cannot come to the bank to deposit money. So I was like, what? You do not go to the bank to deposit money? And then they asked me to go to the ATM, and so I got a bit of shock that when you remove people from the process, you remove bureaucracy, but sometimes you also want to pamper yourself, that you want to talk to someone to do things. And when I deposited money for the company, and I asked them, how do I get a certificate that I have deposited the money? So which office should I go and visit? They said, no, you don't go to any office, you don't visit anyone, go online, pay this fees, and you should get this certificate.
Right.
So I think it was, for me, more of a cultural shock on the positive side. But I think, we are all about the stories that we share. But I think, Neil, we have a quiet audience here, but I really enjoyed your presentation. Let me thank you again. And as I said, we are running a bit behind time. So maybe, Sven, if you have any reactions to listening to Neil or myself, you may want to correct our Estonian experiences.
Yes, thank you. I think, first of all, many thanks to Neil and for mentioning the many things we've done jointly in Tartu. And it was really heartwarming to see actually how long this road has been. Don't often think about this. Coming back to the two aspects you mentioned, going to the notary and to the bank, I agree that going to the bank is the key weak point in the e-residency. But I think in the ZipPrime case, we got quite uncooperative worker from LHV side, and I think this was delayed because of this, that the person did not was not very willing to collaborate. And once we got the person changed, everything went quite smoothly. And what regards the notary, then I think the issue was there expanding the board and adding new members to the company. I think it's quite simple if you do everything or add everyone you need from the start. I think then you can pretty much do this online, or you can establish the company online. But you're right in this sense, Neil, that if you need to change people, then this might get a little bit complicated. But in general, yeah, the comments are fully spot on.
So if it's okay with all of you, let me start with a quick presentation, which is around entering European and other international markets. I think Neil did a fabulous job by sharing his real case study. And I'm probably coming from a more abstract observation here, and hope you are able to appreciate what I share today. So when you're looking at the word market, and when you're looking at factors that you may consider from a market entry perspective, I think Neil, if you want, you can always play ball with me, and you can react to my presentation here. But when I look at the word market, there are a number of factors here, like population, the language of business in that country, what is the purchase power parity, what is the healthcare delivery model, what is the physical distance from your home market, what is the disease burden in that country. So let's say we take an example of India here. So the population is large, the language of business, let's say in most cases in English. The purchase power parity is compared to Europe, it's a way more different. The market is very price sensitive. The healthcare delivery model in most Nordic countries is publicly owned, whereas in India it's privately owned. And let's say from a disease burden perspective, we are experiencing a lot of non-communicable diseases here in India today. From a medical device regulation perspective, until recently we didn't have any our own medical device regulation, and we were relying more on the CE and the FDA marks. And again, the healthcare data protection regulation have been there in US in terms of HIPAA, and in Europe now recently a much wider GDPR regulation is there. And the business model is also something that you need to consider when you're running your own organization. Then looking at your own cash flows, the time bandwidth that you have, and your own social and emotional reasons why you want to enter one market. Maybe you are from one ethnicity and you want to enter the market where you are coming from, and do you have access to a soft landing program in that market? Is there a government supported B2B event that is attracting you to look at that market? Or you have a local government office in that country? Are you using your embassies or trade organizations in the target market that you want to enter? Do you have endorsements from the key opinion leaders in that market about your product? So I don't know, Neil, if I can request you to open your mic and maybe react to my factors. Is this list making sense to you, or is this something you have more factors that you consider when looking at a market?
Well, for us, it was a special case. It was more to do with the ease of setting up a business in the EU, apart from the bank part, and the fact we had to physically visit the notary. So that was one side, and being able to manage the business from a distance. But also we knew people in Tartu working in our sector, and we knew the people at the biobank. We knew what government support was available. So I think the Estonian choice was more circumstantial, but we were obviously attracted by the management at a distance, and also the entrepreneurial spirit that there is in Estonia. I think that was a big factor.
Yeah, indeed. I think, where I was looking, Neil, was, as I said, you were very specific in your example, but let's say if I were to share this as a coach, this kind of a checklist, this may give, people some ideas, what kind of questions that they should be asking themselves, when entering a new market. So let me just illustrate this, a bit further, and let me also emphasize the digital aspect here. As we know, with COVID, Neil also mentioned that his company's business got accelerated because of COVID. And I think everybody today agrees that COVID is a change agent. And of course, digital and AI enabled devices, they are continuously evolving. I think regulators also do not understand them really well. So the regulation aspect in this domain is something where, digital service providers may come and create claims, but from a medical perspective, the medical domain always need evidence. And let's say if you're building a behavior change app and you say that people can lose weight, so are you doing any peer reviewed publications? Are you doing any collaborative approach with the clinicians or the regulators to bring, more evidence so that it can be supported? So this is where I look at it from an abstract perspective. But let me illustrate this with, some real examples that I have dealt with in last 4 or 5 years as a, market access coach. So, tomorrow we are planning to launch this massive open online course by a UK-based organization. It's called My Diabetes, My Health. And they were actually doing this campaign very successfully in UK, which is a type 2 diabetes course. And they were looking to enter Indian market. And, I was personally very interested in the topic of diabetes because I was diagnosed with it. So, when I met Dr. Debbie, who was the founder of this organization, we volunteered to help them. And over this last summer, we helped them, recruit Indian experts and, somehow contextualize their course in English, which was more from the UK context to the Indian context. And I believe, when you look at such digital-based interventions, many times, these kind of projects, they take some kind of funding support. I think their work is supported by Innovation UK. And since we were volunteers from the Indian side, I just checked with them yesterday, for example, what's their plan in future. And they said, would my organization be interested being a partner with them in the future, proposal writings. So I think one of the lessons that I want to draw from here is that when you're looking to enter a new market, maybe one approach could be, like what Neil said, about exploiting EU funding. But I think many countries in Europe and outside Europe also have funding instruments which can support joint collaboration. So people who are listening to this, I don't know the origin of your country, but you may explore if your country has some joint programs and with which markets, and maybe you can explore some kind of paid pilots. And those paid pilots may help you recruit the right kind of local partners, because after the pilot, you will know whether the partner delivers or does not deliver. Then giving you another example, recently I was getting this from the Lund University in Sweden. So they have developed this antibody test for COVID-19. And so, we got a lot of these kind of requests during the COVID times. And, when you are talking about any test kits, in India specifically, now the regulators are trying to be a bit more cautious. So they want to know whether the test kit is already approved and it's a market which is very price sensitive. So they want to also know what is the cost. So when I'm getting such requests from Europe, these are the two questions that I normally ask people, and it helps them. It also helps me, whether this product is ready for India or not. So then another example I would like to share here for another Swedish company. It's called MP Diagnostics, and we have a presentation today from Pawan as a case study. So Pawan, for example, is an Indian origin person who's the founder of the company, and his company MP is solving a problem which is of tuberculosis diagnostics. So it's very much an Indian problem. So if you refer to my checklist that I mentioned, so it is a Swedish company, but it is solving an Indian problem. And if the person is also of Indian origin, maybe he has some social and emotional reasons. And since India is a price sensitive market, so over the last 2 years, Pawan has managed to set up a manufacturing unit in India. So I believe in this case, when MP was trying to enter India, so this case study somehow tells us, why it happened, how it happened. Then the last example I would like to mention here is of Eye Care Finland. It's a very innovative company that I have come across, and very superior in terms of the solution. So they have these intraocular pressure devices called as tonometers, and they recently acquired an Italian company which makes fundus imaging cameras, and the devices are very high quality. So the eye care people approached us to organize a webinar, and this webinar was probably a similar webinar like this, but instead of us, the target audience were clinicians. It was organized by a group of clinicians who were already users of this technology by Eye Care's partner. And so they were basically all key opinion leaders, as you can see here in the left side of this image. And I was also moderating this webinar. And what I realized that, from this kind of style of building conversation, this company was able to proliferate, their device into a new market, which is India, with a handful of key opinion leaders. And towards the end of the webinar, one of the clinicians shared this picture that how much he loves this device. So I think for a device manufacturer, this can, nothing can be better than this, a clinician, giving this kind of a testimonial. So if I'm not sure if I'm able to really illustrate, all the points from the checklist that I shared here, but let me, quickly summarize, because, I can base some of these case studies of working with companies, from different parts of the world, for Indian market and for other markets. That what I find interesting, if you're looking to enter any market, is based on so we were part of the CB Health Access program. This is the delegation from 4 countries in the Nordics, and we were helping these companies. You can see some of the logos here, MP and iCare. So today we are having a presentation from MP, and one of the things I realized is that you should have a good target market connection. Like in the case of Neil, like he mentioned, he knew Tartu University, and he knew Sven, maybe he knew Tartu BT Park. So I think in Europe, almost every country is well organized in forms of local and regional cluster, and they often receive funding to enable export promotion program. So most of the companies that I've helped, they were receiving some kind of funding, and so they were not paying us directly, but it was the clusters who were paying us. And even in my own personal case, I have seen it really is valuable to be part of the local community, and be part of some chamber of commerce, because these chamber of commerce regularly organize a B2B meeting. And also when you are looking to travel to a distant market, if your country has an embassy in that market, I'm sure that embassy has a trade desk as well. And in my experience, most of the European member states, they are doing a great job in export promotion in distant markets. But some lessons from normal consumer market, like marketers are very good in selling consumer products to marketers. But if you are somebody like Neil who is entering a market, so they should also know who is their local partner in a very much similar analytical rigor, that a marketer would define their target audience. So it really helps, for you to filter who to meet in a B2B meeting, and what kind of profile, if you can already draw of a local partner, it may really help you focus your energy. Then, let's say a country like India, we may have many conferences going on. So it may really be wise for you to choose which conference is relevant to your product line. And most of the conferences these days have B2B meeting tools. So even before you travel or after you travel, you can really maximize your ROI in terms of the market entry. Then of course I would also like to bring you to this thinking that people often sell their product, but people need not the product but solution. So I think we should also when we are making a field trip, we should also look at how can the product be evolved, and can we bring in partners which can bring the extra aspects. So I believe a lot, and I've been running a lot of these kind of workshops which help people understand the the market and the business model. So I really believe that if you have an opportunity to do some kind of a brainstorming with local people around your product, it may be very beneficial to you. And I really believe that new kind of sales is partnerships. So instead of directly making customers in a new market, if you can create good partnerships and build an ecosystem around your product, I think the sales is automatic. So I can finish my presentation here. I hope I could finish on time, or slightly ahead of time. If you have a question right now, you may type in the chat. And in the meantime, I would request to bring the first case study from Pawan Aslapuram from MP Diagnostics.
My name is Pawan Asalapuram, the co-founder and CEO of MP Diagnostics. MP Diagnostics is a company whose mission is to end tuberculosis pandemic. And we wanted to stop the spread of multi-drug resistant tuberculosis. Our mission is to provide simple, accurate, rapid, and inexpensive tuberculosis diagnostic solutions to the people who are fighting tuberculosis. Why tuberculosis? Because tuberculosis has infected 1.7 billion people across the world. 4,000 people die every day because of tuberculosis. The treatment costs from $30,000 to $170,000. The treatment one multi-drug resistant patient in Africa costs about 30,000 euros. Whereas if the same person develops extensively drug resistance, then he costs about 710,000 US dollars in USA. We need 30 billion euros for the tuberculosis management every year. As you can see here in the picture, no country is safe from tuberculosis. TB can spread by a single cough, and it can affect any part of the body. 1 in 3 people remain undiagnosed. 2 in 3 are getting incorrect antibiotic treatment. As I told you before, we wanted to provide proficient diagnostic solutions for tuberculosis. We take the sputum sample and we extract the DNA from the bacteria. We amplify the DNA by using our own proprietary patented molecular technology called padlock probes and rolling circle amplification, and then put it on the lateral flow strips. That means that we wanted to provide a simple solution in a pregnancy test format, which is very easy to use. As I told you before, we amplify the DNA. Once the DNA is amplified, we put this DNA in this cassette. As you can see here, as similar to the pregnancy test, it develops the visual results. The cassette shows whether the patient has tuberculosis or not. If he has tuberculosis, which antibiotic to provide or prescribe. We have tested this test in Spain and India. We have shown the sensitivity up to 92% and the specificity between 90 to 96%. We strictly follow WHO guidelines in order to provide efficient and proficient diagnostic solutions. We have developed 4 different products. So we can use these products depending upon the need. We can detect multi-drug resistance. Our test can also detect extensively drug resistance. That means that it can give an indication to the doctor whether the patient has developed extensively drug-resistant tuberculosis, which is a severe form of multi-drug resistance. We're also working on developing a mobile application. That means that the technician in the laboratory can take a photograph of this cassette, and the app does the image analysis and provides the digital report according to the WHO recommendations. Our technology is scalable. That means that the same technology, the same setup can be used for the detection of coronavirus, for example. During these years, we have developed a collaboration with 14 different countries, whereas we have established a close association with at least 8 WHO national reference laboratories. We have filed our patents. We have completed our successful preclinical evaluations or preclinical evaluations in India and Spain. We are looking forward to go beyond and expand our clinical evaluations in other countries. Now, the interesting part, the question and answers. The first question that Sachin has asked me, what did you, what did you expect before you started the plans for India? So I was thinking that, okay, since I know India, since I hail from India, it's a very straightforward, I know the people X, Y, Z, and A, so that the business will be very straightforward manner, so and then I can billions of money. But in reality, it is like this. So that means that we call this as a neural network in science. So that means that all the processes are happening. There are several people, they work on several layers, and the work is getting done. But it's very important for us to identify the key players and the key steps. If we can identify the key players and the key steps here, then India is a wonderful country to do business. What did you adjust? My aim is to drive in this traffic. Probably you might have seen this picture in the internet. But in order to do that, we certainly have to do some adjustments. Of course, we have to do. One of the important things is that we have to establish a local contact. We have to do real market survey. Real market survey. And then we have to meet the expectations with the quality. And India is a price-sensitive market. If we can consider and adjust these 4 parameters, then our ride will be very happy. If you want to read the business, the do's and don'ts, India is a quite complex country with different cultures. and different people. So one strategy may not be applicable in the other part of India. So we have to be flexible. It's so important for us to be very flexible, and we have to sometimes act spontaneously to devise the process and the plans. More importantly, it is a really good homework that we have to do. Why, where, when, and what, and how are you going to do, and what kind of outcome that you are expecting in India. So it's really important. I will do that. I mean, I can give the same advice as many people can give. That means that everyone has its own pace. So we cannot rush people. There are 1.3 billion people in India. So it's a really big country. There are so many channels, so many healthcare setups or stakeholders. For example, there is state government, there is central government. Sometimes central government says okay, but state government doesn't. But state government says okay, but central government doesn't. So everything has to be everything has to be deeply analyzed, and we have to make a plan that is suitable for us. That means that, again, it takes time, and everything works in its own pace. I wish you all the best to do business in India. India is a vibrant country. There's a lot of business opportunities. It's a great country, but we have to work with the proper plans, with the established network. I wish you all the best again. Thank you.
So that was Pawan Aslapuram for you. I didn't formally introduce Pawan before we had his presentation. So Pawan is a quite multidisciplinary person. He started as a pharmacist, and later he trained into biotechnology, and he has worked with some of the top labs in Sweden. I don't know if you have heard of SciLife Lab from Sweden. And it's from this lab that they have developed this product. And I find his work very inspiring. And one of the real reward of the work that we do is to work with inspiring people like Pawan. And this was Pawan's story, bringing his product to life in Indian market. And as he was sharing, it's a very complex market. It's not easy. And, like Neil mentioned, maybe his experience with Estonia was pretty simple, but it really depends on which part of the world you are entering and how your experience is. So next we have Mr. Sri Ganesh Rao, who is a very seasoned professional coming from the technology side, and his experience spans leading IT organizations, large-scale IT organizations. And he has been now MD and CEO of Caligo Technologies at Bangalore, India. And in this case study, we will learn about Caligo's, entry to Australian market. And Mr. Sri Ganesh also has a European connection. He is doing right now his PhD on 5G from Aarhus University in Denmark. So can we have the presentation of Mr. Sri Ganesh?
Hello, good afternoon. I'm Sri Ganesh Rao, Managing Director of Caligo Technologies, based in Bangalore, the Silicon Valley of India. We are a 6-year-old data science and machine learning product and services company focused on solutions in AI, big data, and HPC domains. We are one of 4 Indian AI partners for Intel and one of the 10 worldwide HPC partners. Our big data platform is part of the Intel's AI Builders ecosystem. We represent World Health Organization's special focus group of AI for healthcare. We were the winners of Health 10X competition and have participated in the Sydney Landing Pad program. Combination of big data, analytics, and AI has led to the transformation of existing services and creation of many new data-intensive services. It is critical that organizations harness the power of technology and data into an effective strategy to remain competitive and create significant value. However, organizations are unable to harness data effectively to get actionable insights Due to limitations of the traditional data analytics platform with regards to the scalability, complexity, functionality, cost, and limitations of handling dark data. Our solution, Calico Intelligence Data Analytics Platform, SADAP for short, is the answer for this. It can ingest any type of data, be it structured, semi-structured, or unstructured, from various sources, does data cleansing and data discovery, and can integrate with any standard data visualization tool. Our platform has features which are unique and superior to our competition, include AI at all layers, based on HPC and HPDS, providing performance at scale, edge deployable, data anonymization and encryption, and designed for global standard 1 M2M. Our target domains includes healthcare, smart grid, smart vision, smart city, workplace, and telecom. Our current traction includes screener for diabetic retinopathy, demand analytics for global smart grid company, video surveillance analytics, restricted item baggage screeners, digital transformation, and workplace transformation. Our customers include global MNCs. We all have 25 plus years of experience working for multiple MNCs in the past, holding leadership positions in technology, business, sales, and marketing. Now I'd like to present Calico Health Engine. Diabetic retinopathy is the fastest growing cause of blindness worldwide. China, India, Indonesia, and Bangladesh alone represents 45% of the global burden. The problems are huge population of diabetic patients and less number of ophthalmologists to handle them. This is even worse in the case of community screening or rural areas where there are inadequate facilities for diagnosis, investigation, and management. Also, community screening requires quick results whether the image is gradable or not. Current testing, if at all, are very slow. Finally, the cost of testing will be prohibitive. Ideally, it is required to identify only the patients from non-patients so that ophthalmologist time can be effectively utilized. Our solution is like this. Captured image can be sent to the device. Our engine will analyze and give the results. If the person is affected, then the graded information will be captured and will be sent to the ophthalmologist for further treatment. This will help them avoid going to the ophthalmologist often to check their progress. The key benefits of our approach are early detection, automatic feature extraction, advanced image processing capabilities, low cost and low resource, accuracy over 96%, local language, highly scalable and extensible to other areas of eye diseases like macular edema and glaucoma, hypertensive retinopathy, and other diseases like oral cancer and cervical cancer. During mid last year, as part of Australian government initiative, a flagship event called Health 10X was organized by University of New South Wales and George Institute of Global Health for healthcare startups in India and Australia. We were one of the 11 companies selected amongst a large number of applicants to present our solution in Delhi to a jury consisting of senior doctors from All India Institute of Medical Sciences. This included both Indian and Australian healthcare startups. I am happy to say that we were the winner of this competition. This gave us the opportunity to present our solution in Sydney to a large audience consisting of doctors and senior officers of the government. Also, this gave us the opportunity to interact with local ophthalmologists to get our solution validated by them. This engagement gave us the confidence to enter the Australian market. Sydney Landing Pad 2020 is Australia's #1 program for high-growth global companies to expand into the Australian market. This program is for SMEs and scale-ups to create market entry strategy for Australia and provides access to vetted service providers and industry insiders, investors, and mentors. We decided to make the Australian market entry through this program. We were fortunate to be one of the 12 companies selected out of 150 plus applicants worldwide for this program. This was scheduled during March, April this year. However, due to the pandemic, this program got postponed and finally got converted into a virtual program. We went through all the requirements of the program, got a good understanding of the procedures for establishing our company in Australia, the HR policies, taxation, and various visa programs. We did get connected to mentors who helped us throughout the program to plan the Australia market entry. The final demo night was conducted virtually with a large audience consisting of investors, government officials, and industry leaders. Apart from the presentations, We did have a good number of visitors into a booth where we could interact with them face to face. We did have good response and have been taking further our discussions with the investors and prospective partners and customers. Now, let me try to answer the specific questions given to me. What was your motivation to enter the Australian market? I always had plans of expanding in Australia because of my personal connect with Australia. I'm a part Australian and have lived and worked in Australia earlier. I continued my association with Australia through my connection with Australian Computer Society, Australian India Business Council, and Australian Alumni Network. It was very exciting for me when I came to know that UNSW and George Institute is conducting a health tech competition in India. This gave me an opportunity to make an entry into Australia. Life sciences sector in Australia has seen 16% growth in the last 2 years. It is considered as a strategic sector by the Australian government where it offers generous R&D tax incentives. The focus is on biotechnology and medical devices and health technology. AI and big data are fueling this industry in Australia. There are about 1852 life science organizations, out of which 387 are medtech and digital health organizations alone. 161 life sciences companies which are listed on the stock exchange has a market capitalization of approximately $170 billion. All these factors were encouraging to look at the Australia market entry. What did you expect before you started your plans for Australia? After winning the health competition in India and being invited to participate in the demo night in Sydney, I had expected that we'll be able to get our product Calico Health Engine quickly into the Australian health market. What was the real situation? We got the opportunity of participating in the demo night in Sydney and made a pitch and product demo to a large Australian audience of investors, government officials, and industry leaders. We could talk to a few ophthalmologists and get our product validated by them. The Australian healthcare system is different from the healthcare system. The Australians are covered by a government healthcare system called Medicare. We also came to know that it is required to get our product TGS certified to be used in Australia. This would need funds and would be time consuming. How did you adjust? We decided to outsource the TGS certification to local biomedical agencies experienced in this field. We also decided to talk to investors for getting the funding for certification and the go-to market in Australia. If you were to redo the same, can you save time? What are the do's and don'ts? Become part of government's supported accelerator program, which would give us access to local mentors, investors, and industry leaders. And this is exactly what we did by applying to Sydney Landing Pad program. Selection and participation in this program gave us all the necessary inputs and support to expand into Australian market. I would advise others not to enter without doing deep research into the new market requirements. Now that you are beyond the initial hurdles, any advice for future approach? It would be difficult to get Australian clients directly, at least initially, until the brand is built. It would be good to partner with local system integrators and consultants, at least initially, and slowly build the team and the presence there. I would suggest to plan any mandatory product certifications much earlier before trying to enter the market there. It would be easier to partner with local experts in these regards. Do you expect to be easy further, or you anticipate hurdles that you may be able to address with the new mindset better? Yes, I expect it to be easy going with all the inputs gained through our participation in the Sydney Landing Pad program and planning well ahead.
Yeah, I think, Mr. Sri Ganesh, COVID is probably the most unforeseen actor in your story.
Yeah.
And I think you must be dealing with it as you are speaking. But let me first congratulate you on this amazing milestones and this journey of yours that you have shared with us. And we are grateful to you for sharing your experiences. So now, as per the agenda, we have more like an open house where we share experiences. So if you stay with me, I will also like to invite Neil and Sven back, and let's have a more open house if you are okay. And
Sure,
I
definitely.
would like to invite attendees if you have a question, if you want to speak out, my colleagues can give you the access to the mic, or you can type your point of views on the chat. So Neil, are you okay to participate?
Yes, I'm here.
Okay, very nice. So you learned from Pawan, you learned from Sri Ganesh, and you also learned from me. So any quick reactions to that, Neil? Anything
Well,
new that you found?
I was also, I quickly asked my colleagues in Turkey if we could test for TB in a saliva sample, and my colleague says yes. So maybe I should talk to Pavan offline. But yeah, very, very useful. And you know, moving into Australia, they have some very, very good support there, Sri Ganesh, as you explained, and of course the cashback scheme for R&D, where I believe if you have a subsidiary in Australia, they will pay you 43.5 cents in cash for every dollar that your Australian subsidiary spends in Australia. And that doesn't just have to be clinical trials. That can be a medical device. It can be a diagnostic. It could be a service of some kind. As long as there is a risk of failure, then that's considered R&D. So, you know, it's a shame we don't see those kind of incentives quite so much in Europe. Matching funds, or at least partial cashback. There's another system in Canada, I forget the name. It sounds like Shrek, but it's not the cartoon character. But they will also give you either tax credits or cashback for locating your R&D in Canada. But yeah, they're two very interesting environments. And the Australian FDA is extremely fast. You can get your clinical trials started far quicker in Australia than you can anywhere else. And the data will be respected by the FDA and the authorities in Europe, EMA and national authorities.
Yeah, I think what you're hinting at, Neil, is these mutual recognition agreements. And the benefit of working with markets like Australia is that they have these kind of MRAs with many of the developed markets. So it may work out to be very cost efficient. And in fact, I met a lady from UK who is an Australian citizen, and she was, her main core offering was to facilitate clinical trials in Australia, and the results will be respected in the larger part of the world. So thank you, Neil, for sharing your viewpoint here. I think these additional points were very interesting.
I'd like to add one more here. In Australia, there is a scheme for, like any company, it needs one Australian resident director for establishing the company. So the founders or the senior management team can opt for what is called as a global talent independent visa, which is a permanent resident visa for having talent in the fields of agri-tech, space, advanced manufacturing, fintech, energy, medtech, cybersecurity, etc. So if a person can, who has talent in these areas, would be able to get a global talent independent visa, which is a permanent resident visa, and it will be an ideal one for people outside Australia to kind of, apply for that and then come and establish the company there.
Thank you, Mr. Sri Ganesh. I think Chile also offers this kind of a visa. It's called Startup Chile, where they try to attract a lot of startups. I think countries world over are trying to be attractive. So I don't know, Sven, is Estonia having any cards?
Yeah, I think the sort of startup visa is Estonian one initiative, but of course it's been there are similar measures across the world, and for example also in Europe, I think Poland is offering something, or at least was offering a year or two ago, 50,000 for companies to move to Poland. But in Estonia, the startup visa is meant for foreign founders. I think this is mainly popular from outside the EU, of course, and Ukraine, Russia are Belarus, I think, are the range of companies, but probably also India and some other Asian countries that are interested in this activity. But unfortunately, we don't offer any financial support. So this is definitely sort of our weakness. But we fully understand the need for startup companies and the need for innovators, and to invite more people inside. I think where the political situation currently in Estonia is not fully favoring these kind of activities, but we are all doing what we can in this regard.
I think, Sven, what Estonia offers is also a good tax break, or not tax break, or let's say a good tax scheme. I think there is zero corporate tax, if I'm not wrong, Neil. So your Estonian entity would not have to pay any tax on the income, but of course.
Yes. So until the so you don't pay any income tax until the funds are taken out of the company, and if the profits are shared between the owners, then you have to pay the income tax. But this is the personal income tax. But there is no company income tax. Yes.
Yeah, so here in India, for example, if our company does not take out money and has income, we need to pay 33% tax. So I think various regimes have, different benefits. But let me ask this question. So I have a question for Neil. So you already made a choice of Estonia. If it was not Estonia, which country in EU you would pick, and why?
Well, being British, though, with an Irish passport, thank you, Mum, I would have said in the past Britain, because you can incorporate a company in about 15 minutes for £15. In fact, there was a ZipPrime UK for a while, but because of Brexit, we pulled out very fast. We see absolutely zero value at basing a company in the UK at the moment, whilst there's no trade agreement on the horizon. Apart from that, Sweden has been very popular amongst my colleagues in Ventac Partners, especially since we've been able to IPO two very early stage companies there that were still in preclinical phase. There is access to investment from medium high net worth individuals who will take a gamble on biotech. It's not quite so cheap to incorporate in Sweden, and I think you do need to put some cash in the bank, but it's not at a level much higher than the rest of Europe. Of course, you're paying a little bit more for accountants and lawyers in Sweden. Italy and Spain, they really need to get their acts together. It's quite difficult, even just incorporating a company here. If they want to be on part of the startup wave, then I think they need to improve their procedures, and it's very little is online.
So if I can react to that, Neil, I don't know, I was expecting maybe you will say Netherlands, because I've heard that, the Dutch are also quite lean, in the way they operate. And some of my friends who are running incubators there, they tell me that it's also possible for taxpayers to put money into R&D, and they get tax breaks for that, which makes it quite attractive for startups. And of course, Sweden is very...
This still exists in the UK, of course. In the UK, they say that biotech in the UK will not be harmed by Brexit. But, I would say, why create problems for yourself? Better to maybe go for the Netherlands if these tax breaks are available, yeah.
Yeah, but I think when you say Sweden, at least in my experience working with a lot of Swedish companies, and since you also had very positive experiences, I believe Sweden in general is a very export-driven country. And the professors also there, I mean, looking at your profile and looking at your, past successes, I think they're very research-oriented. So professors are also very much incentivized to commercialize their research, isn't it?
Yeah, they actually have ownership of publicly funded research, yeah.
So that was the key aspect that I realized talking to Pawan, that why Sweden is very successful, because they allow ownership of the IP privately by the professors.
The thinking there is that if you give the technology to the professor or the research assistant, it could be, they are uniquely motivated, and at the same time, they're probably the best experts in that field to develop the invention. Yeah, of course.
Yeah, I think it's basically going to the Nordic phenomena of trust. And if you trust your citizens and you believe that they will create jobs, then why not? Because, you know, in societies like India, for example, there's a huge trust deficit, and governments are always afraid of giving something to a private person. You know, they don't want to be accused of favoritism. But I think in Sweden, they have made it a policy. And I think that policy is really enabling, you know, creation of jobs. So let me ask this question, hypothetical question to Mr. Sri Ganesh. You chose Australia, and if you were to move westwards, and let's say if I may ask you, I don't know what's your information on Europe, but you have already one panelist who favored Estonia. Which country you will choose in Europe if Caligo has to operate in Europe?
Well, I heard about all the details about Estonia only today, but I've been hearing a lot about Holland. On the various startup schemes they have in Hague, Amsterdam, and all that. And well, it was what I had in mind earlier, but I need to look at it, when I heard about Estonia and about the encouragement about how digital it is and all that. Well, uh, it is actually something that I really I need to kind of work out. So Denmark is one place because I am actually conversant with that. I lived there, so that's always there, and we have the innovation. Like I also have very good connects with all the other research people and the professors there. That would be another place that I'll be looking for.
Yeah, so I think listening to you, Mr. Sri Ganesh, and also in Pawan's example, I also find that apart from the checklist phenomena of why people choose one market, I think the social and the emotional reasons are also quite
yeah, very much
on top, right? So people
yeah.
prefer, choosing. I mean, maybe for Pawan, TV was probably a natural thing to pick up apart from having the invention, being from India, so he picked Indian market. And in your case, you had a Australian connection, so you jumped onto the opportunity for Australia. And even now, for Europe, you are making a favoritism towards Denmark because of your Arus connection. So I think I need to add this into my presentation quite high on the priority that social and emotional linkages, I think they are much important than the objective assessment of text breaks and other information. Do you agree or disagree, Neil, on this?
I have to say we knew that it was favorable from a tax point of view to locate in Estonia, but it was very much more using the network and the personal contacts that drove us, combined with the convenience of operating the company from outside Estonia.
So maybe we can say birds of a feather flock together.
Could well be. And actually, one of our board members has known the founder of the biobank for many decades, so that was a factor as well.
So are you talking about the Matspelu?
Yeah,
okay.
Metspalu and Rolf in our picture in front of the university. Rolf and Anders Metspalu go back many years.
I think I will do a bit of advertisement here. So in the part of the SILIS project, we have also done a research report on the market. So we have done a report covering the Estonian market. Ellery was behind it, and we have also covered Australia. So maybe Mr. Rao, you can give us a feedback on how our findings were. Were they? Maybe you can add to that. And we have also done coverage of Indian market. So if anybody is interested in the audience, I think Ellery would be, later probably sharing the details of the report. And also, I think at this point, maybe we would like to wrap up the discussion. And maybe before I call it off, maybe I can invite Sven again to say a few words, but I think there's some remarks from Govind, and Govind has always been very active in these webinar series. So he's talking about market familiarity seems to be a major factor in deciding which markets to enter, apart from the social and emotional connection. I think, end of the day, Govind, I believe it's about the convenience that a person feels in operating. So social and emotional factor make people very comfortable. And I think, as you rightly pointing out the word familiarity, I think it's, navigating systems, you know. So I think maybe in the case of Neil, he was quite familiar with the Estonian system, and whether we may call it a social or an emotional aspect, but maybe familiarity builds the social and the emotional connection. So familiarity is probably the first step, and social and emotional is the second, isn't it? Do you guys agree, disagree, Mr. Rao? Or
I agree with this. So knowledge of the place and the people and all that, it makes things easier.
right, right. So I think that's it from our side today. Thank you, Neil and Mr. Rao, for playing
Thank you,
the
Sachin.
active role and sharing your knowledge. Sven, over to you for any concluding remarks.
I am adding my camera again. So many thanks, Sachin, and also all the other presenters as well. It was a very insightful meeting and a lot of good information regarding the market. So it was a great pleasure to hear, at least for me. I hope it was also insightful for the audience. And from the project side, we are soon following up with additional events. So we're happy to communicate more about those in the upcoming weeks or months. So many thanks for all, and looking forward to meeting you already in the next events. And have a great evening. Cheers.